morning again, everybody. It's always a pleasure bringing our audience new and important information to both our seniors and their families. Today we have another great show for you. As always, we invite you to call in with any questions during the show. Today we're very excited to have two people you should know in our community. And if you don't know them now, you will one day. So as we always try to do, is help you plan for what will probably be inevitable in everyone's life at some time or another. Well, today we'll be discussing what happens when you go to the hospital and one of the valuable services hospitals provide you. Today we have Donna Parris, Manager of Care Management, and Heather Lacoco, who is one of the case managers from Advocate Sherman Hospital. Good morning, ladies.
Good morning.
Good morning.
Donna, why don't we start off? Tell us a little bit about yourself and what you do in your role as Manager of Care Management.
Well, Jim, thank you so much for having us. As the Manager for Care Management, my job is working with a wonderful team of nurses and social workers who provide care for our patients in the community, especially for our seniors who from time to time come in the hospital and have discharge questions or discharge needs. And so I coordinate with the rest of the team to get that care for our patients.
Very good. Heather, tell us a little bit about yourself and what your role is as case manager.
I am one of the nurse case managers, and if a patient was admitted to the hospital, we do an initial assessment on every patient to see what as a nurse, I'm looking at what their history is, their health history, what's brought them to the hospital, what their current home situation is, and how to get them to home in a better health state, and what those services are that's offered by the community and through their insurances to provide them with very good care and recover well.
Excellent. I have to mention this. We were talking about this over coffee, and what a great team Advocate Sherman Hospital has in the way of case management, and actually the whole team. The longevity at Sherman is just absolutely phenomenal, because Heather has been with Sherman how long?
18 years.
And
I'm young. I'm the young one in the department.
Yeah. We can tell that about you, yes.
That's
Yes.
true. We have care managers there for 30 years, 31 years.
That is unbelievable. And we know how tight the Elgin community is, too. Heather went to St. Ed's.
Yes.
And has been basically, you live in Lake in the Hills now, right?
I do.
Okay, very good. And Donna, you're originally from Jamaica,
Yes.
which is fantastic. And you've been with Advocate how long?
9 years.
That's
Yeah.
both these young ladies do not look like they've been anywhere 9 years.
You're kind.
So.
Gee, thank you.
So anyway,
So I think what I'll do is address this question to Donna and ask you, our show is called Silver Solutions Radio, so we're geared towards seniors.
Right.
So if you could tell the audience how your team works with seniors to meet their needs.
Jeanette, it's very interesting that a big part of our population is the senior population, and oftentimes when they come into the hospital, either the patients themselves or their families, they have these needs, but they're not so sure how to meet those needs. They're not so sure what kind of resources are there available to them. So as the care management team, when we go in, like Heather said initially, she does an assessment of their social needs. When we go in to meet with these patients, talk to them, we do that assessment. What are they going to be needing? And then we have lots of resources. Because for us, we feel like making sure we have those partnerships, especially in the Elgin community, is really important. So we use the resources that we have to meet each specific, and every senior is different.
Right.
Someone may need home health care, someone may need to go to rehab, someone may need a caregiver in the home. So we make sure that we're finding out what that need is and use our resources to meet those needs. And we involve the family all along the way also.
And it's all customized to the individual patient.
Absolutely.
Yes.
and regarding this, again, as we were talking this morning, you know, our show is to help people plan, and that's exactly what you guys are doing by providing these resources, because people usually don't talk about this before they go to the hospital, right?
That's
Correct.
Okay. So, again, that's why we have the show. So, everybody that's listening, you know, this is very important to start talking with your family right now about the resources that are available. And if you have any questions, I'm sure Donna and Heather would be available to answer any of them.
Absolutely.
Heather, let's address this to you. How important is the collaboration with outside partners to you?
Very important. We need, you know, as a care manager, what our role is to help facilitate your care. For those that many times are not planning ahead, is why they're in our audience, whether they need services or not in that moment, is to give them those resources, because many times they go home and don't know what's out there. So always being on top of who's current in the industry, in the area that's providing good care. There's many different agencies and options, but it's our role to know who's out there and providing good services, giving them lists of caregivers, senior services. You know, they're up on top of what's in your community, in your area, transportation options, veterans benefits, and all the benefits that many seniors don't know to themselves and their surviving spouse.
Right.
That there's many services that can help with that. The elderly law attorneys and their options to help you, guide you. So many times if a patient comes into the hospital, I might not need to provide all those services, but I want to give them a resource packet. And many of those things are those living experts, those senior living experts that can help you plan now or in the future for what you may need.
Very good. Can you, excuse me, can you give me a couple more examples?
Sure.
We talked a little bit about senior resources and things like that. Kind of go through just a real quick list of some of the things that people might want to have before they come to the hospital.
Right. So if you don't have an advanced care plan, you know, if you live alone, so it again depends on the individual. Do you live with family? Do you have family near you? Do you have a spouse that's healthy or not? If you're a senior living alone, when you come into the hospital, it would be, what are your physical ailments and your medical ailments now? What do I project or think you're going to need at discharge? When you go home, whether you need home health or a caregiver for a short period of time or long term, here's all those resources. Maybe you're not driving anymore or shouldn't be, or having a harder time, or for a short period of time during recovery can't. Giving you those resources that are individualized within your community. A caregiver list, if maybe it's just short term. You know, many times I'm on a surgical floor. So a patient that I see is either planned or non-planned surgery, and you need to have somebody with you, especially the elderly, if you're going to go home for at least a minimum of a week, 24 hours a day, to be sure that an injury doesn't happen, that you're recovering well, that someone's doing your laundry, making your meals, going grocery shopping for you, all those things that you wouldn't think you need help with, but you do now. So if you don't have that family member, a spouse that's healthy, or children that can be there with you, then it's that caregiver list, because a home health agency, nursing, physical therapy, can't be there 24 hours a day, 7 days a week.
And I don't think that a lot of people realize that. You know, I think that when we get a lot of calls with potential clients asking, you know, if Medicare pays for our service, because people think that, you know, the insurance is going to cover it.
Right.
You know, and insurance does cover the home health, but this is not considered medical care.
Correct.
To help with the activities of daily living.
And that's something that we address early on. Many times it's a shock, it's a surprise. So it's how, you know, here's the time now to reach out to family or yourselves, or look at what's going to benefit me. I know it sometimes is oh, that's expensive. However, is it really? Because for that short, even if it's just a week or 2 weeks, to prevent you from having a fall and now having a potential catastrophic event, bringing you in the hospital even sicker, it's to your benefit to have that. If you can't have that family or church or a rotation of people to help you when you're going home, and planning that in the future, at some point you might need that, planning ahead and knowing that and understanding that resource, because many times we see seniors and people in the hospital, it's an event that you didn't plan for, you're in a crisis mode, and on my unit again, if even it's just a small a planned surgery, I want to present to you that these are the resources that you need to start thinking about now if you haven't, because you don't want to make these decisions in a crisis mode. You want to have planned when I need that, or if I need that. You may never need it. At least you have those options available to you that you want.
I agree. Sorry, Jim, but I think one of the other important things that I find missing with a lot of our seniors is because they're maybe in a healthy state, having a power of attorney for healthcare,
absolutely.
Having someone that can speak for them if they're not able to speak for themselves is what we find missing a lot of times when our patients come in hospital. And so one of the services at Sherman that we provide for seniors to are chaplains. Our chaplains meet with these families, talk to them about power of attorney for healthcare, and that's one of the things that we'd like them to get before they come in. Because a lot of them come through our emergency department, they're going to our critical care unit, they can't make that decision, they're not in a mental state to make that decision. So having that ahead of time is something we encourage our seniors to get.
And this, you were reading my mind, because now when you go into the hospital, this is a two-part question. When is a patient assigned a care manager? And then what forms or what items do you suggest bringing in with them?
So if someone comes through our emergency department, they meet our first care manager. We have care managers in our emergency department, so they're assessed there first. Once they're sent to a floor, whatever unit they go to, they get a care manager, because every unit has a care manager. And we see all of our patients, especially our elderly patients. We like if they have what we call a power of attorney for healthcare form. If they have that before, we'd like if they will take that in with them. If they have a do not resuscitate form or a post form per Illinois law, we would appreciate if they took that in with them, because if we know what their needs are while we're caring for them, then we can work with them to meet those needs.
Sure.
And the last minute, as Heather was saying, trying to do it in a crisis mode never really works.
No.
I hope everybody's listening. That never works.
It never works.
And sometimes I encounter some fears of appointing a power of attorney. So there are some conversations that if a patient is there for some time, many times, hospitals now a quick turnaround. You're not there for a long time. It's get the acute event over with, medically stabilize you, and move you on to that next level of care. And our role is to assess what's the most appropriate next level of care. But sometimes when you're building a relationship, I will find there's occasionally seniors that are uncomfortable. I don't want someone to make those decisions. Are they going to make the wrong decision? But what you need to understand is any one of us at any given time can have an event that we can't make our own medical decision. And it doesn't have to be your spouse or your child. It could be a best friend. It's whoever you know will make the decisions for you that you would want. So it's appointing that person that whatever your wishes are, you've expressed that to them, and you feel that they will be able to follow through with what your wishes are. If you don't have that in place and you're in the hospital and you can't make that decision, there's a surrogate form that's enacted. It's a hierarchy. So it's spouse, living child, a parent. So we will have to utilize that. Now maybe your spouse is not the person that you would have wanted because if you feel that they wouldn't be able to enact and their emotions might get in the way of making those difficult decisions. And again, it could only be during a recovery of surgery. This isn't long term.
Right.
This is only enacted when you cannot make the decision. A power of attorney does not grant that person the ability to override you and your wants and needs only when you cannot make it. So you are always your own power of attorney in healthcare.
And if you don't make those choices ahead of time, that surrogacy, if it cannot go through, then you're appointed a guardian by the state. So you don't want it to be extended like that for someone else to be taking care of your needs. It's best if you make that early in, because it's that power of attorney or that surrogacy or the state.
Mhm.
They're going to be the
Right.
ones taking care of you, and you really do not want that to happen.
Hmm. We just had a couple of weeks ago. We just had Nancy Dorjath on, and wouldn't you guys love to see this? One of her big passions are getting everybody from the age of 18
Yes.
forward with a health power of
Yes,
attorney
absolutely.
in hand.
Yes.
Yes.
So
Yes.
so everybody 18 or older go out and get
Get
one.
it. Get
That's
it.
right.
It's awesome. You know, this weekend I heard the speaker. Her name is Hattie Bryant. She did this wonderful presentation on how important it is for families and everyone, like you said, Jim, 18 years and older, to make that decision early so you can have it your way, like Frank Sinatra said.
I like
Just
that.
making sure that you are the one making your decision for you
Sure.
about your health care. And everybody wants that.
Absolutely, and who wouldn't? So get your papers in order. Let's do this. It's
I
going to
agree.
make your life easier.
I agree. I totally agree.
And
with
it
that.
does not need to be done by an attorney. When you're in the hospital, like Donna said, the chaplains can come and it just needs to be witnessed. So it doesn't have to be stamped with approval. It does not need to be done by an attorney. It can be done in the hospital setting.
Yes.
You can get them online. You can get them through the hospital when you don't have to be an inpatient either. You can have a power of attorney. It's not a hard, difficult thing to do for healthcare.
Right.
So if you ever come to Sherman Hospital, just ask one of our case managers. Ask one of them to get you that form, and we'll get it done for you.
There you go.
Look at that.
See? And so clearly, if you're planning a surgery or something like that, you should come in advance and just get it done.
Yes.
Absolutely.
Yeah.
Yes, and many times the doctor's offices will already put that in place and ask you that. When you are scheduling a surgery, that is going to be one of the questions that nurse is asking you for pre-op testing is, do you have a
Excellent.
power of attorney? If you don't, do you want one so that when you are admitted before surgery takes place, you can have that done?
Excellent.
And so
Excellent.
hopefully the listeners are seeing the importance of it, because now, like, it's going through multiple channels. You know,
Right,
more
right.
people are trying to encourage people to have that document. So clearly, it's
Yeah.
important.
It is
Yeah.
very important.
So we're talking about when the hospital stays are shorter now.
Yes.
Yeah.
You know,
Yes.
so right now what's happening, I know, is in the emergency room, some of our clients have been admitted or just for observation, or they're admitted. So can you talk more about that? Because I don't think the general public understands
Sure.
that.
Yeah, it a lot of people have been talking about inpatient admission versus observation, and there are many questions about it and much discussion. And I've even gotten calls, because I usually am on call on the weekends, and I'll be home and someone calls me to say, oh, this patient really wants to talk to you because they're upset that they're in observation and they understand that it will not be paid for. So just for clarification, especially for our seniors Medicare population, and most insurances follow Medicare rules. For a patient to be admitted as an inpatient status, Medicare says it must be medically necessary. So let's say, Jeanette, you come in for your stomach hurts. When you come into the emergency room, the physician is not sure why your stomach is hurting. So the first thing they're going to do your assessment, and they're going to say, okay, Jeanette, if the pain is that bad, let us observe you. We're going to do a couple of tests, and based on what that shows, we may have to switch you to inpatient, because then there's more work we're going to need to do.
Right.
So there are some diagnoses that automatically we're just going to do an observation. Even initially for chest pain, we will do you observation. That's what Medicare says. We have to do your observation. But let's say we put a stress test in and we're showing other stuff, or we take a blood test and your troponin levels are elevated. We're going to have to switch you, because we're going to have to do lots of workup.
Sure.
So that inpatient status is based on your medical status. Most people these days are in for observation, and for Medicare even more so. If you're just going to be a one-night overstay, you have to be observation. So I understand that people feel that it will not be paid for, and that's not true either. And Heather may want to explain that a little bit.
Yeah, with the observation, it is covered. So there is that misconception that it won't be covered. It won't be paid for. Truthfully, if we were to admit you as an inpatient, that won't be covered. It would get denied. There's no coverage if you don't meet that medical necessity.
Observation is covered under your Medicare benefit. It's not covered under the Hospital A insurance. It's covered under the Hospital B or the Medicare Part B. If you have a supplement, then it's covered. You're fully covered. So it is also another way to encourage patients to not just have that Hospital A benefit, that as you age and different things that you need, that Medicare Part B and a supplement will get you covered. The Medicare Part B is all outpatient services, physician coverage at 80%. That supplement will cover the other 20%. Hospital A covers 100% for an inpatient hospital stay when it's medically necessary. Or those replacement plans. There's a lot of those Medicare replacement plans that also cover both inpatient and outpatient or observation status, just in a different way.
Excellent. What if a patient needs any services after leaving the hospital? How do you know which one is right for them?
Multiple different things. It might be their medical status and how well are they? How well are you ambulating? Do you have any wounds that need to be addressed? So we look at, if you're going home, who are you going home with? Of course, that's most everyone's desire is to get to home. So it might be a level of care if you're appropriate for home, or do you have that help at home? Do you maybe need home health that's covered under your Medicare or your Medicare replacement plan for a nurse, a skilled nurse, skilled reasons, medication management, disease education, wound management. But again, home care nursing, wound care management is teaching somebody to do that, not come in and do it for you.
Right.
Physical therapy to come into the house. Again, it's only spurts of care. So for an hour to 45 minutes per visit. So maybe only 3 visits for the week. If you need above and beyond that, or again, if you can go home and you have these home care services, the skilled care, then maybe you don't have someone at home or your family needs help. Maybe it's providing a list of caregivers that can be with you to do the day-to-day chores, the daily living activities, helping you get dressed, getting out of the shower, non-medical things. If you need more than that, maybe you have been in the hospital for a week and you're very deconditioned and you need that more aggressive therapy, aggressive rehab, where you can have therapy every day, nursing 24 hours a day. That's covered under your insurance benefits to go to a rehab center.
Right.
So then it's working with you as to which rehab center would you want to go. It's all about choices. As long as they take your insurance, we provide you with the list of choices and can answer those questions as to who provides the care in the area that we work with closely or know a lot about. We encourage always families to go visit and decide with home care or interview places of who you need for a caregiver. Or going to those rehab centers.
So sometimes it's not like we're 100% sure what's right for them. We help them to decide what's right for them.
I like that.
But you're the options that are
guide
available.
you.
Absolutely.
Yeah, it'll be, you know, here's what we recommend, you know, as the clinician or physical therapy or even the physicians, here's the recommendation. It's ultimately, whether it's the right choice in our eyes or not, it's the patient's choice. But it's trying to help you understand and make that choice and give you all those options. And sometimes maybe the choice is we want to try and go home and have the caregivers or the home health. So we will still give you that list of, if this doesn't work out at home, here's the next step. Here's your alternative option.
And
Here's the time frame.
If it doesn't work out at home, what is the time frame to be able to go into a rehab facility?
Yeah.
So they have that 30-day after they leave the hospital. So for example, we send them home and they need to flip. So we try to have a plan B for our patients, especially for those when we do the assessment, we're questioning like, even though Jim wants to go home, is that truly the right thing for him? Because sometimes Jim may want to go home and we're like, no, it's not good. But he's insisting he wants to go home. So we will give him a trial, but we have a plan B at a rehab facility if the family's okay with that, and they can do that within that 24 hours or that 30-day window. Their insurance will allow them to do that.
Okay.
And that's great. That is great type of help to help a family work through that process, even while they're there. Because I know how stubborn I can get. Okay, and I'm sure you see a lot of me at the hospital.
Absolutely.
And I want to go home, but I'm not physically capable, or let's say mentally capable of taking care of myself at that time. That you do have that plan B in force that a family can say, and help that person understand through the process too.
I totally agree. And one of the things that and this is totally off the wall, but we have a physician advisor that works with our group, and he wanted me to make sure that I mentioned him, so I'm going to plug him right now.
Oh, very good. Excellent.
Dr. Michael Rosenberg. So what we do is we work with Dr. Rosenberg, especially with some of our patients. Let's say we're finding it difficult to even talk to them, or we want an extra person to go in to have a little conversation. We just pull Dr. Rosenberg, can you go and talk with this patient and family for us? And he will go in and have that conversation to kind of make sure, because we want people to be safe.
Yeah,
all the
it's
time.
safety.
So that's very important to us, so we do that.
I'm going to try to get this last question in real quick because I know the how important your guys' work is. What other ways does your team help work with seniors in the community?
One of the things that we have is we have a lot of our care managers and social workers who are involved in things in the community, like senior services, open door, work with all these community affiliates that are there. And recently this year, what we did, we had a seniors fair at our hospital with all of Elgin community, not all of them, but those we work with a lot, like Silverado, senior services.
A lot of even our support groups.
Yes.
A lot of different, we partner with a lot of support groups and house them at Sherman Hospital as well. So we do that a lot for bereavement, for ostomy, for stroke, for caregivers. It's not just for the patient, it's for the caregivers too. We partner obviously with all the different senior the palliative care also. There's the palliative care and hospice and palliative care, but palliative care is so different, and there's a misconception with palliative care too.
Right.
We also do, we have oncology support groups. We have navigators. We have nurse navigators within the hospital for different disease processes.
Excellent.
That are another level of support and services beyond what we know. It's more disease specific. So we have oncology nurse navigators that can assist somebody with all of the partners that they have to help someone once they get into the community manage their disease process well.
Wonderful. We're out of time. Do you guys have a number? Is there a main number if somebody should need help?
The case management department number?
224-783-8760. That is our number for care management. It's 224-783-8760.
Ladies, thank you so much for being on today, and we'll have you back.
Thank you. Thank you, guys.